What happens when billions of taxpayer dollars, meant for the most vulnerable among us, just vanish into thin air, fueling these massive systemic fraud scandals across the entire nation?
Welcome back to the deep dive. Today, our mission is really to cut through all the noise surrounding these explosive allegations of fraud. It's impacting major government programs nationwide, and we're looking at sources that just paint an alarming picture of oversight failing, well, catastrophically.
And it seems to be centered, at least for now, in Minnesota.
Yes, the numbers coming out of Minnesota are just shocking. Federal prosecutors are now estimating that the potential fraud in some of these social services and Medicaid programs could hit $9 billion.
$9 billion, with a B.
With a B. And get this, that figure represents more than half of all the funding in those high-risk categories since 2018. It's just ripped the curtain back on the incredible scale of this unchecked waste.
And this isn't just some isolated state issue, right? That $9 billion hole is now driving a huge national policy debate.
It is.
It starts with accountability. For state officials. We saw Governor Walz face so much scrutiny, he eventually withdrew his bid for a third term. And then it goes all the way to Washington, D.C., where Republicans are really seizing on these failures.
They're demanding strict, immediate reforms to stop this kind of abuse in massive federal spending programs, especially things like the Affordable Care Act.
So we're really unpacking that core conservative argument here.
Yeah.
That this kind of unchecked spending, combined with, let's say, lax oversight, has systematically created a taxpayer nightmare.
Exactly. Our source stack today has reports detailing just massive theft from poverty relief programs, and we're juxtaposing that with this very clear, very sharp legislative effort happening in the Senate to stop what critics are calling systemic rot in our healthcare system.
So we'll look at how the money was stolen in Minnesota, how political maneuvering might have actually made the problem worse.
By overlooking those early allegations.
Right. And then we'll look at the specific steps being proposed in Congress to, finally put patients and taxpayers in charge, not the providers and the insurers.
Okay, so let's dive in. We have to start where this all exploded, which is Minnesota.
This is segment 1, and it really is the anatomy of a systemic failure. It shook the state's entire political foundation.
When you just look at the raw numbers, the scale it's almost hard to grasp. By early 2026, federal investigators had charged 98 individuals.
98?
In connection with these various schemes. And they've already secured 62 convictions. Acting U.S. Attorney Joe Thompson is the one who put that potential total at $9 billion. And that's just across 14 identified high-risk Medicaid programs. It's just a stunning level of institutional failure.
So here's where it gets really important for you to understand the how. How does this actually happen? The biggest case we're tracking is called Feeding Our Future.
Ah, yes.
It was a nonprofit claiming to provide meals to kids during the pandemic. They ended up defrauding the state of over $250 million.
It was a massive ghost site operation.
Right.
The sources show the fraud was basically done by submitting claims for meals that were never served.
Just made up.
Completely made up. Or they'd wildly exaggerate the number of kids they were feeding. The money was just being funneled to fake food vendors, to shell companies controlled by the defendants.
And what's so fascinating here is that the Minnesota Department of Education, the MDE, they were the ones distributing the funds. They found irregularities, obvious red flags, as early as 2020.
And this is where the political dilemma, according to the sources, just completely paralyzed the state government, the official investigator from the state's own fraud office.
Who was Somali-American himself, which is a key detail.
A very key detail. He reported that the Walz administration was incredibly reluctant to pursue those initial fraud allegations.
And the critique here is pretty blunt. It's that the fear of political backlash, of being portrayed as racist for investigating a scheme with a lot of Somali Americans involved, that fear trumped fiscal responsibility.
Absolutely. That hesitation had catastrophic implications. It basically sent a signal to fraudsters that the system was wide open for the taking.
And that signal was apparently heard loud and clear across other state programs.
Oh, clearly. By 2025, Minnesota had found 14 other high-risk Medicaid programs that were just hemorrhaging money.
Like Housing Stabilization Services, HSS, and Integrated Community Supports, ICS.
And take that ICS program, the one for adults with disabilities, this program just it exploded. It went from costing about $4.6 million a year in 2021 to nearly $180 million in 2025.
That kind of growth, that exponential spending without a verified increase in the people being served, That's the loudest possible siren for fraud.
And this is where the abstract numbers turn into just a devastating human tragedy.
Right.
Our sources show the consequences went way beyond money. The complete lack of actual care from these fraudulent providers has been connected to the death of at least one person in that ICS program in 2025.
Unbelievable.
And we also see this clear pattern of criminal networks. At least a dozen defendants from that $250 million Feeding Our Future case also owned or were linked to autism centers, another high-risk Medicaid category.
It just shows that once the system was known to be soft, the fraud just moved aggressively into any poorly monitored program for vulnerable people.
The political fallout was swift. Late 2025, early 2026. Governor Walz faced intense criticism. He was accused by a Republican representative of willfully turning a blind eye to the crime.
And in the end, he withdrew his bid for a third term.
He did. And the federal response was just as sharp. The Trump administration froze federal child care payments to Minnesota and launched federal audits, citing, quote, widespread and systemic fraud.
So that's the moment a state-level failure becomes a national political weapon.
That's right. And it leads right into our second segment. The political damage in Minnesota was done, but the story didn't stop at the state line. This became a huge issue in D.C.
Focusing on federal taxpayer money and, interestingly, immigration policy.
We see that focus immediately in Congress. One incident that really caught national attention was an earmark sought by Representative Ilhan Omar, a Democrat from Minnesota.
Right.
She was advocating for about $1.03 million for a Somali-led addiction recovery organization called Generation Hope MN.
And that earmark was pulled, wasn't it?
It was removed from the final spending bill. Reports came out that the organization shared a commercial address with a Somali restaurant.
And in this kind of environment, with a massive fraud investigation going on, even the appearance of impropriety gets intense scrutiny.
And this feeds directly into that larger conservative critique our sources highlight. It's about assimilation and immigration oversight. Senator Tommy Tuberville, for example, he directly connected the Minnesota fraud to a failure of assimilation.
He said what, that Somali immigrants were caught stealing more than $1 billion and counting from taxpayers?
He did, and his critique went further. He alleged the money was being sent back to Somalia to fund terrorism. He called the fraud a classic example of groups taking advantage of the system.
That's a very powerful, very politically charged accusation.
It is. And we have to frame it against the numbers from law enforcement. As of December 2025, 82 out of the 92 suspects indicted in these cases were Somali American.
And that concentration led to a lot of criticism aimed at the whole community, including from President Donald Trump.
Right. The structural argument being made by conservative lawmakers is one of basic accountability. They argue if systems are designed to be easily exploited, and if mass immigration isn't checked by standards for assimilation, then fraud on this scale is the predictable result.
So that brings us right into our third and final segment, the national picture. We're moving from Minnesota's state programs to the fight over waste and fraud in federal health care, specifically the Affordable Care Act.
Or Obamacare. Republican lawmakers are pretty much unified in calling it a failed, flawed fraud program.
And they're backing that up with stats from the Senate floor debates. They argue Obamacare has caused average individual premiums to rise over 220% since the law was enacted.
And the current flashpoint, the legislative battle right now, is over the expiration of these enhanced premium tax credits.
Democrats want to extend them for 3 more years.
At a cost of an estimated $83 billion to the taxpayers. And this is the key part. With no meaningful reforms to stop the abuse.
Republicans are calling that more waste, fraud, more ill-obtained profits for insurers. So could you walk us through the specific fraud mechanism they're describing, this zero-claim subsidy scam? Because it sounds like a massive loophole.
It's astonishing. Lawmakers allege that insurance brokers are systematically enrolling people into ACA plans, sometimes without the person even knowing it.
Without their knowledge or consent.
Right. So the insurance companies can then collect the huge federal subsidies, our tax dollars, while knowing they'll pay out 0 claims. These are ghost enrollees. The insurance company gets the monthly federal payment for nothing. It's pure profit for them and a catastrophic loss for the taxpayer.
So the lack of real verification means the system just pays out whether the patient exists or not.
Which is what prompts the Republican counterproposal. It's from Senators Crapo and Cassidy, and it's a sharp contrast. They're focused on structural reform, patient empowerment, and cutting down on fraud.
And they say their plan has concrete, measurable results.
They project it will do 2 things right away. One, lower healthcare premiums by about 11%, and two, reduce payments to insurance companies by an estimated $30 billion. dollars.
30 billion. That's money they argue is just being siphoned off right now through waste and insurer profits.
Exactly. And beyond the cost cutting, their proposal has some really specific fraud protections. A key one is quarterly verification against the Death Master file,
Which sounds grim, but why is that so crucial?
because it automatically kicks deceased individuals off the rolls. It closes this really common, really costly loophole where insurance companies keep collecting federal subsidies for people for years after they've died.
And their plan also ties into the immigration debate.
It does. It restricts federal Medicaid funding to states that give health insurance to illegal immigrants. The overarching argument is about shifting power and demanding accountability.
So the Republican position is that they want to drive down costs and empower patients with things like pre-funded health savings accounts, HSAs.
Paired with more affordable, competitive insurance plans. They argue that continuing the status quo is just compounding the problem. The choice they're presenting to Congress is pretty clear. Structural reform for the patient, or an $83 billion extension for, as they claim, the insurers and the fraudsters.
So we've taken a deep dive today into the extraordinary details of alleged fraud. Fraud that could be up to $9 billion just in Minnesota's state programs, which is tragic for the vulnerable people who actually needed those services.
And we connected that failure to the high-stakes battle in D.C., where Republicans are pushing back hard against this massive spending extension in the ACA, citing estimates of up to $30 billion in waste from systemic fraud.
The critical thread connecting both of these stories at the state and the federal level is accountability. Or, well, the lack of it.
Whether it's state officials who looked away for political reasons or Congress extending subsidies without real protections, the core question is still there. When does the generous intent of these big government programs stop justifying the staggering multi-billion-dollar cost of waste, fraud, and abuse to the American taxpayer?
Here's a provocative thought for you to explore on your own. If federal prosecutors allege that fraud can consume half or more of total funding in high-risk social service programs, like they claimed in Minnesota, how quickly does the country need to shift its priorities from just expanding access to strictly enforcing the security of every single taxpayer dollar, making sure the money actually gets to the people it was intended for? Something to think about as the cost of government oversight keeps being measured in the billions.